Welcome, viewers, to another session on how to perform cupping on our channel. Today we are basically going to demonstrate how to cup a patient on their kidneys. Cupping the kidneys is recommended generally as a overall sort of MOT of the body, a general sort of detox. It could also be, if there's a particular problem in that part of the body as well. So we're going to demonstrate this as a sort of a general video. So the patient himself has no issues, alhamdulillah, with his kidneys, but we hope we can sort of demonstrate how to cup this area. So what we do is we apply 3 cups along this sort of imaginary line, which is quite close to the spine, and then another 2 cups rather, right next to the 3 cups, and then 1 further cup just below that. So it's almost like a triangle. Okay. And this of course has to be repeated on both sides for symmetry, because of course the body has 2 kidneys. And these spots further up aren't related to the kidney, but they are generally good for general service or MOT of the body. Apparently these 3 spots on the top are very good for high cholesterol, as well as high blood pressure as well. So as mentioned, the top half of the points are for high cholesterol and improving blood pressure, and the bottom half is for basically detoxing the kidneys. So we immediately see very dark blood coming to the surface. Especially up top. it appears this patient is much in need of cupping, judging by the coloration of the blood. So although the blood seems somewhat even, I can definitely see a larger layer on the spot just below the neck. So we're going to leak this just to allow some air to come in. So we're keeping the pressure up. So it's been about 5 minutes now. We can see the accumulation of blood is definitely increasing, especially for the cups on the top. That's the blood flow and cholesterol points. The bottom four are also showing signs of blood accumulation. It's not as great, but we do see very dark blood being withdrawn from those spots as well. So we're going to give it a few more minutes, 1 more minute to be precise. Then we're going to start taking the cups off. So this cup here and the one on the opposite side definitely have the greatest amount of blood, and that's because they're related to the heart, as well as the liver as well, especially this spot here. So in terms of like frequency of doing these general spots, which we can sort of class as like a general MOT of the body, one may ask how often we should be doing this. So you should do it in addition to regular exercise as well. But we would recommend, in today's day and age, given the given the diet and the pollutants out there, we would recommend once every 3 months would be ideal for a patient to have this sort of general MOT of the body. And that's it. We're not going to do any further points beyond this. So this is this is considered a sort of heavy session. So we don't want to overcut the patient. That's also because we previously did additional points on the leg as well. If you didn't see our previous video. So after we've cleaned up these incision points with antiseptic spray and then Germaline, we will of course then apply the pads with the plasters, and the patient will be ready to go, ready to return back home. It is recommended the patient doesn't drive, and of course takes iron tablets as well. Okay, that's it. We hope you've found these videos useful, and if you could drop a like, share it with someone who needs it, and don't forget to subscribe for more natural healing tips. Thank you.